and we gave him a biscuit, and his whole face broke out, and I had to rush him to urgent care, and then yeah, we found out it was really severe. Ben's pediatrician recommended, I said I was really frustrated that there wasn't really anything that we could do, and how severe his reactions were becoming, and how much of a challenge it was to the whole family, because trying to go out to eat or trying to go anywhere, and like the stress that it was causing. And he said, well, why don't you try this guy? He's a lot more cutting edge, and he might be willing to try a therapy that would benefit him.
Isn't it just where you get what your allergy is in very small doses?
There you go. Yes. So it's just desensitizing him little by little, which seems amazing to us, and that it could have. His sister had done allergy shots, so we were familiar with it from that concept. But the idea that he would eat the food, and that would make him less allergic, seems crazy. You were scared.
I was very scared.
Yeah, I think it, after so many years, and, going to the hospital and having reactions and always having to be stressed, the idea that he was going to eat anything with wheat, we were all just panic stricken, thinking that it was going to go badly. But now, like, the difference in just kind of everyday life is dramatic. Well, not having to worry about the cross-contamination issue as much, going to eat somewhere and worrying, what if, yes, we ordered a gluten-free bun for his, but what if the person accidentally touched, something else, or it anything like that. And knowing, well, no, he's actually gonna be fine with that now. I think really just has made our whole life so much, just remove this whole stress and anxiety that we had, I think, as a whole family, for him. Is that right? Great. It's amazing. We expect, I was convinced that there would be, he would constantly be having reactions, and I think we've had a few little pop-ups of hives, but and that's only been a couple times, and other than that, he hasn't had wheezing, he hasn't had even runny nose or anything severe. And that's been, if you'd asked me 6 months ago that he could eat even that amount of wheat and not have a terrible life-threatening reaction, I would have said absolutely not. There is no way on earth. He can't even have a crumb near him. Mm-hmm. So that's been crazy to us. Tremendously, I think, especially just the anxiety, for the whole family, of trying to go on vacation, the food insecurity for him of knowing, are you gonna be able to get something that you want to eat, that is safe for you to eat, worrying that you got something mixed up, or you grabbed the wrong version of something or anything like that. And also just at school too, for him, if the person next to him is eating something with wheat, and that he's gonna inhale something, or all those things, it just taking that away, I think, has been really life-changing for him and for all of us.